Public comments.
So we have three community members sign up for public comments. First would be Ryan Scott. So Ryan, I'm going to make you a presenter and you will have 3 minutes. You should be able to unmute. I don't see Ryan in the lobby, so we'll move on to Carolyn Benetsky. All right, Carolyn, you should be able to unmute.
Okay,
Sorry, were we going to do the statement?
Sure, President Thomas, the
Oh, yes, the statement. That was the statement.
on the agenda.
Okay, hold on a second. Hold on a second, Carolyn. We'll be right with you.
okay.
All right. Okay, so Board of Health provides the opportunity for the public to share their viewpoints and opinion on public health matters. It is not the practice of the Board of Health or agency staff, many of whom are top experts in their field, to review, vet for accuracy or grounding in scientific evidence, or provide responses to public comments at BOH meetings. Opinions expressed by the public should not necessarily be interpreted as accurate if staff or the board does not challenge the perspective. Thank you. Go ahead, Carolyn.
Okay, can you hear me?
Yes, loud and clear.
My name's Carolyn Benetsky. I live in Boulder. Recently, after several attempts to obtain information from Lexi Nolan and Cora about the Boulder County focus groups for vaccine hesitant parents, I was able to access BCPH's report through Cora. The document was written by a PR group called Godot. On page 2 of the document, people who had doubts about the COVID vaccine were categorized as misguided, intentionally ignorant, intentionally misinformed, holding beliefs commonly tied to other conspiracies. It really is shocking for BCPH to categorize their fellow county residents in these disparaging terms. The definitions demonstrate the bias of BCPH against parents who have decided not to give this experimental shot to their children. These focus groups are clearly pressure groups designed to coerce parents to inject their children with a shot that has virtually no safety data for children, and long-term is very important for children, and has resulted in serious adverse effects for millions of people. There is no indication that the parents in the focus groups are provided with a list of adverse effects or with informed consent, which is required both by Nuremberg Code and the US Drug and Cosmetic Act for an experimental product, which this still is. All vaccines in this country are still under experimental status. For 2 years, we have been pummeled by the media with the message that the shots were safe and effective. We've learned that the Biden administration made direct payments to nearly all media to push only positive coverage about the COVID-19 shots. This was $1 billion that was given to media. Are the shots effective at stopping transmission? More than a year ago, CDC Director Rochelle Walensky admitted to Wolf Blitzer on CNN that the COVID vaccines don't stop transmission. In a recent paper, Dr. Fauci and 2 other officials from NIH wrote that the shots have deficiencies and they also, quote, elicit incomplete and short-lived protection against evolving virus variants. Dr. Kessler, who was Biden's chief science officer until mid-January, recently said that the vaccines don't prevent infection or transmission. We also know that we have 3 databases that show the vaccines are not safe, many side effects. Children have close to 0 chance of dying from COVID. The risk-benefit analysis is against giving these injections to children by orders of magnitude. They don't stop infection, they don't stop transmission, and they have a terrible safety record. It's time to stop pushing this dangerous shot on children, parents, and all people who decline the shots and exercise their right
All right, Ryan, I see you've logged on. So Ryan, I will make you a presenter and you can unmute.
Hi, this is Ryan back again. Yeah, shame on you for mislabeling, vilifying members of the community based on your nonsensical vaccine hesitancy definitions presented in your GODOT study. Pathetic and disparaging all across the board. Labeling those as anti-vaccine is intentional misinformation. Conclusions based on disproven data. The stupidity exhibited here labels you as a group of low-level pharmaceutical reps selling a crappy product. And I mean this seriously. It crosses across all age groups, as you can see by the folks that are speaking here. What a colossal waste of time, money, and resources on behalf of the whole entire team. I'm speaking directly to Indira, Melanie, Lisbeth, Jane, Penny, and Elizabeth. Stick to the facts and stay away from the lame sales pitch. You can't tie a bow on a turd. In your conclusion, you stated, consider the pandemic fearing for our kids and families is totally ridiculous based on any risk profile for a healthy adult or a healthy kid. From lockdowns to vaccines, 100% stopping transmission, to masking, to the half-baked vaccine verification program you introduced, everything is unscientific and wrong, but despite your unwillingness to admit it. What's the cost of ignorant policy decision makers like yourself? It's a lot of FOIA requests, a lot of retractions, you know, the FDA, and they're hoping to suppress information for 75 years. I don't know if anyone paid attention to the Cochrane Library, the golden standard of independent research that concluded there's no evidence to support the use of surgical face masks or N95 respirators to prevent influenza or COVID-19. This was 11 randomized trials. I didn't take time to read that. The drumbeat on excessive deaths is becoming deafening. All-cause mortality is higher, which is the complete opposite of what you'd expect with a successful pharmaceutical product. Your inability to discern between the lack of liability and the profit mechanism is most just astonishing. The CDC data shows that the rate of non-COVID excess deaths in the first half of 2022 was even higher than 2020 and 2021. That's from the CDC. The Cleveland Clinic study showed that for every successive booster that you get, you're more apt to catch COVID and have a negative outcome. Again, we're taking time to read. I sometimes question if you guys are. And also remember, the inventor of the lobotomy won a Nobel Prize back in 1949.
30 seconds.
For posterity, you should go re-listen to the meeting from last year in February, where the community pummeled you for continuing to try and mask everyone, you know, forever on. So to that, I say completely pathetic. You deserve to be castigated by the community because you put out nonsensical studies like that that are just completely ridiculous. So the harder you push, I can guarantee you people are pushing much harder in the other direction.
That's time.
I'm completely happy to see this thing failing. Thanks.
And last, we have Marty Hopper. So Marty, I'm going to make you a presenter and you should be able to unmute and you will have 3 minutes.
Let's see, can you hear me?
Yes, we can.
Okay, should I start?
Yes.
Okay, hi, my name's Marty Hopper and I live in Boulder. And I'm also speaking to express my concerns about COVID vaccines. To start, I very much want to believe that all of us on this call have the same objective, which is the health and well-being of our citizens. As a result, I find it heartbreaking that Boulder County Public Health continues to promote these experimental COVID vaccines for all citizens, but I find it especially grievous to push them on young children. On your website, you state, quote, the FDA has authorized COVID-19 vaccines for children as young as 6 months old. This statement is not true. The FDA has authorized COVID vaccines for children under emergency use only, yet you chose to leave out the words emergency use, which I find an extraordinary omission, if not an actual violation of informed consent. To date, according to VAERS, over 63,000 COVID vaccine injuries to children alone have been reported. In a Harvard study in 2011, found that fewer than 1% of vaccine adverse events are reported to VAERS. This means that 63,000 is a gross underestimation of the number of injuries to children from COVID injections. On your website, your chief medical officer, Dr. Bob Belknap, states in a video that, quote, there are no long-term complications from COVID vaccines. The fact is that COVID shots for children were approved on June 17th, 2022, excuse me, which is just 8 months ago. What long-term safety data can he be referring to? How can he, in good conscience, possibly make this claim? I also want to mention the focus group project by Godot Communications. First, I found it very odd that the report has no methodology section. Missing completely is information on how many focus groups were conducted, what was the final makeup of the group in terms of gender, number of children, language, etc. Who conducted the groups, what questions were asked, what materials were passed out. I also found it concerning that Godot used Kim White's fear appeal model, thank you, as a way to understand how to approach your target populations for your campaign going forward. In the end, it appears that Boulder County Public Health is paying a professional advertising company to create a campaign using fear-based messaging model to convince parents in our underserved communities to inject their babies and young children with an experimental and dangerous medical product. I find this shocking and implore you to end this project. Thank you.
That concludes public comment.
All right, thank you, everybody. Okay, so on to agenda item 2, which is approval of the Monday, January. Pardon me.
I move to approve meeting minutes from January 9th.
January 9th meeting minutes. Okay, motion to approve.
Second.
Okay, all in favor?
Aye.
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 Okay.
Share with you.
All right, item 3, strategic planning progress and priorities.
All right, thank you, Board of Health. I'm Lexi Nolan, Interim Director at Boulder County Public Health. We are very pleased to be able to update you this evening on the development of our public health improvement plan focused on mental and behavioral health, as well as our strategic planning. Our SIB health planning evaluation team, which includes Kelly Hinch and Elise Waln, Rachel Mental, and Dave LaRocca, has been working with Omni, our consulting group, to develop out our public health improvement plan. They're also going to be providing some updates and timelines for the strategic plan development, which is underway. We're expecting to have high-level strategies for the mental and behavioral health FIP by the end of March or early April, and the strategic plan by the end of the year as we build out our strategic priorities and apply them to programs. It's different from our previous strategic planning process in a few different ways. We are really working not only to identify the strategic priorities, but to build out how those priorities show up in our programs and our work in a more comprehensive way. We are going deeper in relation to a community engaged approach in the development of the plan, and also in thinking about how do we engage with the community as in the implementation process itself. And we're really relating the plan to our programs across the agency to build out a unified vision that helps to coordinate our work and also enhance our accountability. So today's updates will provide you with information since the last strategic plan update, which I think was towards the end of the year. And excited to be able to share with you what's been going on since then.
Fabulous. So this was actually supposed to be Lexi's cheat sheet slide, but we've kind of given a high level overview here. So can we click to the next slide? We can dive right on in. So good evening, everyone. My name is Elise Wall, and I'm the Health Planning and Evaluation Program Manager here at BCPH. I'm joined today by Kelly Hinch, our Strategic Initiatives Branch Director, as well as David LaRocca, apologies, who's our Mental and Behavioral Health Coordinator, also housed within the CIV division. And the purpose of coming to you all this evening, as Lexi already kind of kicked us off, is to provide you all with a high-level overview of and updates on our upcoming public health improvement plan, as well as our upcoming strategic plan. And we'll also have some time today to discuss alignment between those key BCPH plans and this overarching county behavioral health roadmap. And Kelly's actually going to kick us off first and foremost with an image that I believe you all have seen previously.
Yes, so thank you so much, Elise. Yeah, before you even jump into this, I just want to just really applaud the efforts that Elise and Rachel, Dave have done in this space, and others, the management community within the staff have been really supportive. It's a huge lift and a complex one. So yeah, like as Elise was saying, y'all have seen this one, except we kind of switched up some of the dates, right? You guys are going to have the slides with this, so you can take a look at this more. But just as a reminder, I'm going to hit just a couple highlights here. We talked about having mental and behavioral health be our public health improvement plan priority about a year ago, right? A little bit over a year ago. It's like January of 2022. We based that off of community engagement process that was taking place by the county, right? And so we made that decision and made a decision to hire Omni as a consultant. They're a consultancy group that's done a lot of this type of work across the state, including a lot of strategic plans and things. And lo and behold, all of our HPE staff we didn't have Elise, we didn't have a health planner. And so it took us a while to hire folks as well. And then all the process it is to get Omni on board, right, with all those contracts and things like that. So Elise stepped on board in August and stepped into the flames there per se. And she was able to really pull some stuff forward with us, with our population epi and Michael Wu. And as you're moving forward on some of those spaces, and in December, Dave came on board as our mental behavioral health coordinator, and Rachel Mental came on as our new health planner. So by the end of December, we finally got a full team. And so since that time, Elise will go into some details, but we've been really working with the consultant on moving forward the community health assessment and public health improvement plan process. And we're also looking at a broader strategic plan. And so we'll bring those pieces together for you during this presentation. But if you look ahead a bit, we're thinking about how are we bringing these pieces together? What's that going to look like? So you'll see that on here. And our goal is to have sort of the broad strategic plan, which includes the public health improvement plan piece, done as a draft by early fall, like September, and then have it finalized by December and a launch in what will be January.
So quick question, Kelly. I have just missed this, but what exactly is Omni's specialty? What is their consulting focus? Is it on planning? Is it specifically public health planning?
They support a variety of planning and evaluation efforts. So they've done a number of public health general planning, but they have supported a number of other counties across Colorado in their own community health improvement plan / public health improvement plan, including, I think their most recent one is Summit County. They supported Summit County in developing their public health improvement plan. So certainly, I don't want to say this definitively. My understanding is that their primary focus is in the public health space, but they have also been supporting even Boulder County more broadly in some other planning efforts as well. So definitely have familiarity with the public health sphere, but do serve kind of broader planning and evaluation needs.
And their focus with us is on the mental and behavioral health plan.
Okay.
And that's a space where we have a long history, not just public health, but other county departments community services and HHS of working with them in that NBH space specifically. So they have a lot of local knowledge about kind of.
Yeah. As I was gonna say, they have their paws in a lot of those spaces. They understand that mental behavioral health space here in the county. And frankly, they also, I'm pretty sure, did the CDPHE's strategic plan as well. So we did a rigorous, Lexi, remember, we did a rigorous screening of the applicants. So anyway, so that's just some platform setting for you, just a reminder where we're at and things like that. So I'll let you go, at least, and she'll go into details.
Sure. Yeah, we'll go ahead and dive right on in. So there we go. So I apologize. So as Kelly mentioned just a second ago, I've been here at the agency since August of 2022. So still getting to know you all. And as Kelly said, diving headfirst into this work. So I apologize if some of this information feels like review. Just wanted to have some kind of key definitions up in front of all of us, so we're making sure we're all on the same page. So as a friendly reminder, we're talking about our public health improvement plan, and there's a lot of pieces that feed into this. One of the key initial pieces and one of the other key pieces we are mandated by the state to provide them as part of kind of the full package of our public health improvement plan is the community health assessment, which essentially is a document and process in which we look broadly and collect quantitative and qualitative data to help us determine what are the current health priorities for the community and what capacity does our public health system have to address those priorities. All of that quantitative and qualitative data then feeds into our public health improvement plan, which, the intention is to build out or identify those focus priority areas and then build out that roadmap for the community and regional partners and where we want to make improvements in public health system and ultimately in population health. And something I really wanted to emphasize here, because I don't know if it comes through enough with these definitions, is that community engagement is essential and kind of the cornerstone of both the community health assessment and the public health improvement plan. Without community feedback on what our priorities should be, without community feedback on what initiatives and actions we need to take, these plans would be not particularly useful and not see much success. So that piece has been thoroughly embedded in both of these processes. Thank you, Jordan. This is more kind of in the weeds details, but again, just wanted to ensure we're all on the same page. As both Lexi and Kelly have alluded to, we are in the process of building out our 2023-2027 Public Health Improvement Plan. Development of our CHA and our FIP, our Public Health Improvement Plan, is mandated by Colorado Public Health Act. We are required to complete this on a minimum of every 5 years. And we are, in order to ensure that we are meeting all of the requirements, we currently use the Colorado Health Assessment and Planning System, the CHAP system, which you may have seen on CDPHE's website and various Board of Health trainings. Also, development of our community health assessment and public health improvement plan are considered Colorado core public health capabilities under the revised Act of 2018. Jordan? So really trying to keep this high level in terms of activities that have been completed to date specific to our public health improvement plan. As Kelly alluded to, I'm kicking this off. Obviously, this conversation has started long before I was brought on board, but in the interest of saving space in the presentation, we're starting this in August/September of this past year. So I was hired as the HBU program manager in August, and we kicked off our contract with Omni Institute in September of this past year. In the later fall, November to December timeframe, we also brought on our new HBE health planner, Rachel Mental, who's also on this call. And we worked to establish a CHA-FIP work group here at BCPH. So this is a group of staff from across the agency that are engaged in kind of that key decision-making and review of key materials by Omni to ensure that we are grounding our efforts in what our various program and divisions are seeing, ensuring that there is that kind of oversight of the process and the key products coming out of this process. And last but not least, Omni, looking at some of the secondary data that our HBE team had already been pulling together, started doing this deeper dive of the secondary data to look for disparities in the mental and behavioral health data that we do have available for Boulder County. Starting off this year, we started off strong. So the CHA-FIP work group did select or identify priority populations that we wanted to do some initial dives with in terms of community engagement and qualitative data collection. So looking at social determinants of health and starting to have some of those initial conversations around strategies and priorities. Omni also worked with our CHA-FIP work group to develop some community outreach materials And they also independently finalize some of those data collection methods. So for focus groups, key informant interviews, and a photo voice process. Thank you. As you can see, we have a busy year ahead in the FIP space and also in the strategic planning space. So specifically for the Public Health Improvement Plan, this February to March timeframe, we are really focusing on community engagement for both the CHA and the FIP. The first step of that really is looking at broad community engagement, as you can see up there, looking a little bit more in depth at that community health profile data, engaging community members in conversations around social determinants of health, and then really trying to head into what what Kelly and Lexi referred to earlier of, starting to dive into those conversations around goal and strategy selection, so that we can head into that April to May timeframe where we are starting to actually do some refinements around the Public Health Improvement Plan and starting to formalize those recommendations that we as an agency would want to see included in the county's behavioral health roadmap. And also gearing ourselves up for any funding conversations, start thinking ahead to supporting these initiatives and the long-term sustainability of some of these initiatives. Last but not least, our plan is to have the formal documentation for the CHA and FIP wrapped up by June so that we can send that off to the state health department. And then obviously the obvious next step from here is really diving into the implementation piece. So then at that point, our HPE team switches tracks, so going from the planning stage to really supporting the agency in the monitoring and evaluation stage.
Can I ask a quick question?
Yeah.
Are any of these dates state requirements? Like, should our planning timeline take longer? Are we at risk of violating any sort of state mandates around this
We are required by the state to submit our CHA FIP by the end of this year.
by the end of the year?
Yeah.
And you plan to submit in June? Is that what you're saying?
Yes, and a large part of that is because that is when the contract with Omni is completed. I will acknowledge we do have a little wiggle room after that if we need to build out any additional pieces, but we really want to make full use of that contract and ensure that all of those pieces are really finalized. But that's where that specific month and date is coming from.
I have another question.
Yeah.
Sorry, I don't know if this is if you want to keep going, I can hold my question to the end.
We have time for Q&A at the end, but I'll defer to our timekeepers. Should I keep going?
Vacation or?
No, I mean, no, it's about the priority populations and sort of from there.
Yeah,
but
we'll
I-
get there.
Okay.
Yeah, we'll keep going. So then switching tacks, we're going to talk about the strategic plan and really I wanted to highlight here, the intent of our strategic plan is to set forth what we as an organization hope to achieve, how we will achieve it, and how we will essentially monitor and evaluate whether or not we have achieved what we set out to. And it's intended to guide these decisions that we've been talking about this whole time, around allocation of resources, staffing decisions, data-driven decision-making, all of those key processes. Jordan. Again, just background information. We are in the process of developing our 2024 to 2028 strategic plan. This is not formally mandated as part of that Colorado Public Health Act. However, it is considered, developing a strategic plan is considered a Colorado core public health capability. So that is one of those capabilities that was included in the revised plan, the revised Colorado Public Health Act as of 2018. Hand this back to Kelly, who this is Kelly's brainchild, this image here.
Yeah, no, I'm not on taking the total credit. It's just a very simplistic space. All I was trying to do here was to let you know, to kind of pull some pieces together on a little bit of graphic space to let you know what sort of the pieces of the strategic plan are, right? We'll build out this graph in a little bit more sophisticated manner or whatnot. But so if you think about the different spaces around our strategic plan, if you see the mental and behavioral health in the green box, right? That's what Elise has been talking about as far as our public health improvement plan, or FIP. That's what that is, right? And you can see it intersects a bit. I included the Boulder County's mental and behavioral health roadmap. And so we're not dictated by that roadmap. We don't dictate that roadmap, but we're a piece of that, right? And so I just kind of sort of Venn diagram-y type thing to put in there. But then the other spaces I think are the climate action, health and racial equity, and sustainability, transparency, and stewardship. If you recall, those were our strategic priorities from our last plan as well that we didn't get to move forward in part because of our work in COVID, right? And, if you think about the roadmap that Lexi pulled together last summer, that really pulls into some of the sustainability, transparency, and stewardship. So those are sort of additional strategic priorities that go beyond the mental behavioral health space, right? Those are the spaces that we're going to go forward with for our strategic plan over the next 5 years. And then there's a space that's called additional priorities that include community engagement, policy, and emergency management. And those are spaces which we're still exploring a bit more. What sort of level of priority will they be at the agency? What will that look like? Because at least we'll jump into a little bit. And I think I shared at the last Board of County Commissioners and Board of Health meeting we had around what it meant to be these things, right? So at least we'll jump back into this a bit. But I just wanted to give you a little bit of visual that these are the spaces we're talking about. We're talking about the strategic plan.
Thank you, Kelly. Yeah, as Kelly mentioned, I'm just providing a little bit more information here so that when you're referencing these slides after the fact, you can reference this. So kind of what we're envisioning at this stage is kind of these two distinct areas of strategic priorities and then these agency priorities. The strategic priorities, as Kelly mentioned, includes climate action, health and racial equity, mental and behavioral health, and that sustainability, transparency, and stewardship piece. And the idea with these strategic priorities is that they align with priority select as part of the 2018. Oh, sorry. Thank you. You already mentioned this piece. I'm looking at that. I'm like, what did I mean by that? You just said, yes, that those most of those key elements do align with what was previously included in the last strategic plan. The expectation is that to be considered a strategic priority in our upcoming strategic plan, that there will be metrics to evaluate success in each of these areas. So looking at annual goals and objectives. The intent is that there will be efforts embedded across the agency as appropriate in each of these areas. And it is expected that, again, in order to be a strategic priority, there will be dedicated capacity and or resources to oversee the planning, implementation, and monitoring of this work. We don't feel like it can be successful unless there is kind of the dedicated resources to see this work through. With the agency priorities, we again anticipate that there will be metrics to evaluate success. However, we're still kind of in this learning and growing phase around determining if and how that work will be embedded across the agency, and if and how the work associated with those priorities will be planned for, implemented, and monitored. We have kind of a plan in place or a vision in place for how we want to move that forward with the strategic priorities. I think there's still some conversations that need to happen at the management team level or planned at the management team level to determine, again, as Kelly mentioned, do these additional agency priorities merit becoming their own standalone priorities that are incorporated into the broader strategic plan? Or does this work get embedded elsewhere and maybe does not make sense at this time to become a strategic priority? You gonna say something?
Yeah, I just want to add something really quick is that we're envisioning this a bit different than the last strategic plan with sort of created sort of silo spaces. Like there was a siloed climate action, sort of a siloed MBH space. And we're looking at this in a more holistic view. We're already doing a lot of MBH work, for example, public health. The community health team in particular does a lot of that work. So we're thinking more about how do we coordinate that space? How do we measure that? How do we move that forward? And also, there's a lot of efforts, in health and racial equity, there's health equity coordinating committee. Even when we talk about emergency management, there's lots of work that's already been going in that space. Right. So we're not starting from scratch, unlike the vast majority of these. These are spaces that have been built and we're basically strengthening these spaces. That makes sense.
And I apologize. I did my Vanna White to Kevlin because we also have hired Kevlin, who is also a leader in that health and racial equity space as well. So thank you, Jordan. So I'll try to go through this as quickly as possible so we can get around to some questions, Q&A. So focusing on activities completed to date for the 2024-2028 strategic plan. Towards the end of this last year, the management team made those formal decisions around finalized selection of strategic priorities and then some of those initial identification of those potential additional agency priorities. So again, still working to finalize those, but at the very least, our main strategic priorities, those were selected towards the end of last year. In terms of what we've accomplished so far this year, our Rachel Mintle, our HBE planner, has been hard at work in developing a strategic plan charter. So essentially, this is a planning document that helps inform our HBE team and how we want to move forward in this planning process. So it includes a wide variety of things. I didn't include the whole laundry list here, but some key things include scope, key stakeholders, those activities and milestones, resources needed, and a wide variety of other planning considerations. So that's what we've been working so far this year. And in terms of upcoming activities, there is a lot in store. So in this February to March timeframe, we're working to finalize that charter with the management team. Our HBE team is in the process of starting to assess, look at our past strategic plan, what were the successes and challenges we saw there, and see how that informs our upcoming strategic plan. And kind of along those same lines, looking at any other relevant data that we feel would be useful to pull into this process as we look to plan for our next strategic planning cycle. April of this year, we are looking to start forming strategic priority work groups who will be really tasked with informing the process of what are the goals and objectives assigned to, that are associated with each of these strategic priorities. What are the resources needed? Who's going to be the point person or persons for this work? Kind of along that same time frame, we want to start hammering out what is going to be our agency's approach for those additional agency priorities. How are we going to move forward in that space? What is our plan for tackling those? Do they merit having their own work groups? Or again, does that work get embedded elsewhere? And then working to finalize within our process, what are those key points in our process that we need staff and community engagement? Obviously, staff will be engaged throughout this process, but making sure that we want to be strategic with how we engage the community and community partners in informing this plan as well. In that May to June timeframe, we'll be working with those priority work groups to start hammering out the priority goals and objectives. And our HPE team will start the long process of building out that evaluation approach, including the framework, what exactly that learning, evaluation, monitoring piece will look like as we move forward in this. Jordan. July, September, and for some of these activities, I just want to highlight, these are not hard and fast. A lot of this work is going to be starting sooner rather than later. As you can imagine, we want to get a head start on as much of this as possible. But at least what we're anticipating for now is in that July to September timeframe, starting to formalize the documentation associated with all this. So developing the report out from the last strategic plan. So having something that we can share and report out to our partners of how did this go last time? And then start building out that documentation for the upcoming strategic plan. So looking at year one implementation plans, budget plans, looking at sustainability. This is obviously a very short list of what will be included in the full document, but just wanted to give kind of a sneak preview of some of those key pieces that will be built out. October to November of this year, the plan is to have the document itself ready for review by the management team and the Board of Health for input. And then our ultimate goal, as Kelly alluded to earlier, is to have this finalized document wrapped up by the end of this year so that we can look forward to a launch in January of 2024. And that was a lot of me speaking. I'm going to hand over the mic at this time to my colleague, Dave, who is going to speak now about kind of the high-level alignment between the public health improvement plan we just spoke about, our strategic plan, and this broader county behavioral health roadmap. So take it away.
Yeah, thanks, Elise. So we wanted to just share a little more about the Boulder County Behavioral Health Roadmap, which we've mentioned a few times throughout the presentation. So the roadmap is a project out of community services that started about a year ago. And it's really a shared countywide plan to ensure that every community member has access to the right mental and behavioral health supports at the right time. And when it comes to public health, we really see our wheelhouse as being promotion, prevention, and some parts of treatment along the spectrum that you see to the right. And that spectrum really is just the different parts of mental and behavioral health interventions that we would seek to influence. So promotion, prevention, treatment in the form of early identification or screening is really where we see the public health wheelhouse. So as Elise mentioned, we're really trying to make sure that our FIP goals and strategies related to mental and behavioral health are in place before the roadmap is completed so that we can make sure that public health is integrated appropriately. And yeah, you can go to the next slide. Thanks. And just to go a little deeper on the public health approach to mental and behavioral health, or kind of our wheelhouse as we described it. This is our mental and behavioral health framework, which I've been told you've seen before. And it's an in-depth evidence-based approach to mental and behavioral health that was developed by BCPH staff. And it really establishes some shared goals, some coordinated objectives and strategies to really guide our work in the MBH space, but also to help community services and HHS understand where public health fits into this spectrum of mental and behavioral health interventions. And the way we really see this being helpful is that first, it can really help us align our efforts. As a few people have mentioned, we have so much work already happening in the MBH space in public health. And this framework can help us align those efforts. It can help us identify opportunities for efficiency, leverage resources, avoid duplication. We also see this as being helpful in terms of identifying gaps. So where, along these strategies and objectives and shared goals, can we make a bigger impact? Can we send resources to? And then finally, we see this being helpful in terms of prioritizing and coordinating funding across the agency that's related to mental and behavioral health. And that's all I got.
Fabulous. So that next steps, we'll wrap this up so we can head into the Q&A session. But so in terms of the next steps from the HPE team's perspective, we will obviously continue to facilitate and or coordinate and or monitor all of that work that we've outlined previously for both the public health improvement planning process and the strategic planning processes, coordinating and engaging with our colleagues across the agency, as well as key partners and community members, again, for both of these processes. And we would love to reconnect with the Board of Health again in April as we work to finalize our 2023-2028 Public Health Improvement Plan strategies, as well as it seems like a good time to provide you all with another update on the status and where we are at in these various processes. So that is something that we would request. And I think with that, we'll leave it for questions. And I know that there was one already regarding population.
Yeah, thank you. So thank you for doing the presentation. It's helpful to just know how it all fits together. So I saw in the agenda, there was the list of the priority populations, and there are many of them.
There are.
So, so talk a little bit about that, because I know that it reads to me like the plan is to do community engagement across all of these groups.
To attempt to as best we
Okay,
can. Yeah.
okay, and okay, so that seems like a lot.
It is. That's astute observation. So the background on that is, so as part of this process, Omni pulled all of the secondary data that our HPE team had previously pulled related to mental and behavioral health, as well as did some additional searching on relevant secondary data. And what they did is they came to the CHOFIP work group with mental and behavioral health indicators for adults and youth. And the question that was posed to the work group was, based on the data that you've seen so far, where do we need to know more? Like, where are the gaps in our understanding? As well as, and sorry, I should have prefaced this by saying, the data that we really focused in on for this conversation was data that can be disaggregated. So where can we look at socioeconomic factors and break the data down that way? And so that's when the CHOFIP work group was asked, based on the data that we see here for the populations we have data for, where do we need to know more? So where are there gaps in that data? And then where are we seeing those disparities? Where are there issues that we believe can be addressed through potentially public health intervention? So that's where this long laundry list came from. And yes, I agree. It is a long list, but I think partially this speaks to some of the challenges we have in secondary data in terms of, for example, there's very, very poor data, secondary data available for the homeless population in Boulder County. And so that, I think, was identified by the CHOFIP work group as an area of, we really don't know much of anything around mental and behavioral health in that space. So the idea for this long list of priority populations is that Omni is working to do some initial community engagement to, again, talk about social determinants of health and get that broader picture of mental and behavioral health where we can with these populations, we acknowledge upfront that some of these populations we have wonderful existing relationships with that we are able to capitalize on. And some of these, we anticipate there's going to be some struggles in getting kind of saturation. So for example, with mountain communities, we really want to make an effort to engage our mountain communities. We at this time are still kind of working out how we can best engage those populations. So the plan is to engage this full population for the community health assessment piece. But when we go into identifying strategies and priorities, the intent is to look at all that data that was captured in the community health assessment to start diving into who are those priority populations that we need to reconnect with to build out the strategies, goals, objectives that are finally captured in the FIP. Does that answer your question?
Yeah, thank you. Two follow-up questions on that then. Is it that this is the long list and then it sounds like you will narrow down that list, prioritize to do the work with? Okay. Yeah, great.
It's also based on our capacity too.
Yeah,
There's a capacity.
Yeah.
There's definitely capacity. I mean, I don't disagree with any of the inclusion of any of these, but like with a limited capacity. And then when you're talking about, is Omni going out into the community and interviewing people who are experiencing homelessness and asking about that? Or are you partnering also with existing community organizations, community-based organizations who might have strong relationships with? Yeah, great.
Again, being mindful of our capacity and Omni's capacity, we're trying to build off existing relationships and trying to go through our BCPH colleagues that have those existing relationships rather than trying to start from scratch. And in those instances where we don't have strong relationships, Omni and in conjunction with our HPE team is reaching out to try and build those relationships. So for example, some of our programs within community health that Heather leads the charge on, we have a number of programs within community health that have really strong relationships with the Latina, LGBTQIA youth community. So we already know that, and there's a lot of work already underway in that space. And so we're looking to capitalize on those existing efforts rather than going out and trying to do this all over again from scratch.
Great.
Yeah, I just want to add something really quick. It's that our work actually includes a capacity assessment, not just looking at our capacity, but there's an actual formal capacity assessment that will allow us to dive deeper or understand that space better. So, it's that we want to do, and you really can't do that.
Yeah.
So.
Yeah, I just wanted to add on that I think that kind of the laundry list of the priority populations is there because we recognize that there are disparate impacts to those groups. And rather than looking at the strategic plan as, just it's a plan, it goes, it's fixed, it goes up on the shelf. It's also a way for us to pay attention going forward to how we continue to build out the plan, how we continue to implement it. So even if we don't, for instance, have a chance to check in and do a fully engaged process between March and May of this year, it stays on our radar that those are the kinds of relationships and engagement processes that we're looking to build in particular places, and we'll continue to work on that.
Great, thank you.
I have one other question. In the mental and behavioral health wheelhouse, why is treatment, long-term treatment and aftercare omitted from the public health domain? Is there another group that is being partnered with that is taking that on?
Because those are the spaces where HHS and community services and mental health partners and so many other community partners put all of their efforts in those spaces and not into prevention.
Okay.
And so that prevention is public health's wheelhouse. It's how we work with them.
Okay, and discussing the new planning process where it's more interactive, more partnership based. How often are you all talking to HHS and mental health partners and those other stakeholder groups?
Yeah, I think there's a number of different ways that we're trying to stay in the loop. So with regards to the public health improvement plan specifically, since that's the main piece in which we overlap with other county efforts in that mental behavioral health space, we are regularly meeting with Marcy Campbell at Community Health, as well as Lindsay Neville.
Services.
Thank you. It's been a long day. Yeah, in community services, as well as Lindsay Neville, who's also in community services and who oversees AAA. She does not oversee AAA. Lindsay Neville is intimately involved in the Boulder Area Agency on Aging's development of their strategic plan, in which we highly anticipate that mental and behavioral health is also going to have kind of a lead role in that document as well. And so that group of us has been meeting regularly for the past on a monthly basis. And now that Dave's on board, we've been having these conversations of maybe we bring Dave into those meetings as well. How do we all stay on board there? And then in terms of other connections to the larger behavioral health roadmap, I think I might bounce it back to Dave and Lexi, because you both are intimately involved in some more of the planning elements on the larger plan. So I'll defer to you both and how you've been engaged in that space.
I can speak at a high level. I have regular meetings with the department heads for community services and HHS, including specific focuses on where the behavioral health roadmap is developing. We have a meeting this Wednesday evening that is to hear from our community partners on their perspective on how it's being built out, so that we have a connection point there in addition to kind of some of the more public health specific connections. So that's like a joint community meeting with community services and HHS. Because Marcy Campbell used to be our Dave LaRocca. Marcy has deep knowledge of public health programs and is able to just kind of very expeditiously say, I see a connection here, here, here. Let's connect back with public health and see if they're still wanting to do that, if that's still on the priority list. So that's been actually a really valuable source of institutional knowledge to make sure that our public health work is also being connected in there. I have regular meetings with the group that's been identified as kind of a pre-executive advisory board type group for the roadmap itself, just to kind of track where we're going over time to make sure that it stays aligned.
Do you communicate with city HHS departments?
Yes. So the city of Boulder and the city of Longmont are both included in that executive advisory board. I also sit on the Regional Opioid Council, which specifically makes decisions about the opioid funding, which is connected to this, but it's not the entirety of it, obviously.
Lindy has a question.
Yeah, hey, thanks for this information. I had two questions. The first is, are the strategic goals that you're setting out, I may have just misheard what was said, but I heard that you're going to measure the goals, but are you also setting quantitative goals from the get-go?
That is yeah. Oh, go ahead. I didn't mean to interrupt you, Lindy.
No, go ahead.
Yes, so that is the plan. And if you mean by the get-go, if you mean by launch of kind of the strategic plan, yes, that is the plan. So we want to be able to quantify what success looks like in these spaces so that we can ensure that we're monitoring and, learning, as Lexi was saying earlier, learning throughout this process and course correcting if need be, and being able to report out to you all and our community partners and the broader community on how we're doing in those spaces. Yeah.
Yeah,
So just to clarify that question though, so are you setting goals, strategic goals that are quantitative? Are you saying you're setting qualitative strategic goals and then you're setting measurable metrics associated with those qualitative goals, or is it a mix?
I'll ask that in just a second, Lindy. I think, Kelly, were you going to say something?
No, a little bit. Yeah,
Okay.
I just wanted to say that I think this, Lindy, it's a great question. And I think one thing that we're really focused on is really building a really good monitoring, evaluation, and learning plan, right? That's probably going to include a mixture of those spaces, right? We're not there yet, right? I mean, we're over the next 6 months or so, we're going to be working on that because we feel that is a space that we need to report out to the community what we're doing, hear back from the community what they feel or what they're doing with that. And then the staff need to understand how they take up some of that work, which they may not totally get at this moment, or they may be doing, but they're not really measuring it, right? So how can we build in those spaces, I think is, it's gonna be something we're really going to be focused on. I think for me, it's one of the key pieces that our strategic plan is going to have that we really haven't had in the past.
Yeah, and to tag on to that, Lindy, I'm biased as the Health Planning and Evaluation Program Manager. My bias would be that it would all be quantitative, but recognizing that we are still in the very early stages and recognizing that in some of these spaces for some of these efforts, maybe where we start out is not as quantitative as might be desired, but that is, from my perspective, is the end goal, is to have ways of quantifying all this, recognizing that, yeah, we are further along in some of these spaces, and in some of these spaces, there is still a lot of groundwork that needs to be done, but I think that's a great question.
Yeah, and I
Yeah,
would
no,
just,
I fully appreciate that and totally get that. So that's really helpful. And then my second question is around you mentioned earlier the data sources that you might be using to inform the strategy planning process. It would be super helpful as the board if we could get more intelligence on what data sources you guys are using to inform your strategy. I'd like to understand that better whenever the time is right, as we start to, launch into this effort.
Thank you, Lindy. And Lindy, just to clarify, when you say the data that we're using, were you thinking specifically for the public health improvement plan, the strategic plan, both?
Probably both. Whatever's reasonable, but I would like to get a better understanding of the root of sort of the evaluation itself from a quantitative perspective.
Sure, and I can give a sneak preview a little bit about the quantitative data for the public health improvement plan. So this is something that we as a group discussed. And so Omni is in the process of formalizing some data briefs that they're hoping to use as part of their community engagement efforts out in the community. So summarizing some of that key data that went into some of the CHAFIP work groups' early decision making. And so the plan is that once those documents are formalized and kind of once those are formalized, we're happy to share those with the board. I think those will probably be, frankly, the most accessible, digestible forms of the data, rather than just kind of turning you loose on kind of a bunch of spreadsheets we have going that are not particularly digestible.
You cleaned it up for the board.
Yeah, well, and for the broader community, because I think data literacy is something we try to be very mindful of, and we want to make sure that what we're communicating is digestible and hopefully easily understandable. So at the very least, we're happy to come back. If it makes sense to bring those in April, or if it makes sense to bring those sooner, once those are finalized by Omni, we're happy to bring those. And then it's helpful to know that there is that interest for the strategic plan, because our team can start thinking about what of that we can pull together and share. Go ahead.
Yeah, I just wanted to add really quick to this is that we have pulled together a lot of we had the community health profile, which really touched on not just mental and behavioral health, but a broader space. And so one of our goals this year is to reestablish the dashboard. I don't know, y'all remember any of that? We used to have the dashboard that was key public health indicators for Boulder County. So we're going to be reestablishing that this year. So some of these key indicators will go into those spaces as well. So it's lots of fun things.
Yeah,
for
we're busy. Any other questions? If not, I want to be really mindful of our time. We have gone long past. So thank you so much for giving us some extra time to discuss all these important planning efforts. Thank you again to Kelly and to Dave. We have our contact information here. If you have any questions, would like to learn any more, please don't hesitate to reach out. We do have a lot going on, but we are always happy to make time for the board and elucidating elements of this process as much as it can be helpful. So thank you all.
Thank you.
Thank you.
Good job. Yeah.
All right. Item 4 on the agenda, staff announcement, health and racial equity manager.
right, so caught up with myself. I am really pleased to introduce to you all Kevlin Ma as our new health and racial equity manager. Kevlin uses they, them pronouns. They joined on January 10th and have jumped into the deep end of our work, already attended an awful lot of meetings, an awful lot of onboarding conversations, met counterparts across the county, met community partners, attended community events. Kevlin was formally trained and has an MPH from Columbia in Health and Human Rights. But they also have a lot of experience in community organizing, consulting in intersectional spaces, and learning how to be an advocate, including from the inside of an organization, which, can be a challenging position to be expected to take on. I've really been impressed already with Kevlin's insights and ability to offer tools and approaches to respond to what they're seeing in the agency, to support us all in that HRE space, in supporting staff conversations and kind of many teachable moments. Hey, let's take a pause here. Here's something I'm seeing, which is terrific for us. It's part of how we grow as a staff. It's about how we become more self-aware, and how we really internalize our effectiveness at advancing the HRE work. And also in beginning to think about how we build out our health and racial equity plan and our work groups that are going to be doing a lot of that work. We plan for Kevlin to return in April to the Board of Health for an update on the HRE work and a little bit of a deeper dive. And in the meantime, I'm happy for Kevlin to share a little more about their background.
Thanks so much, Lexi. Hi, everyone. Happy to be here. My name is Kevlin, they, them pronouns. Yeah, in the sake of time, I'll just try and keep it short. So I've always had this passion and this deep desire to kind of rudimentally just care for people, make sure people are getting their treatments, make sure people are having access to things. But then on that journey, especially at a young age, realizing that certain communities or people in my family or neighbors or just certain people couldn't even get into the door of a doctor's office, or they couldn't afford to, or there was so many different barriers that were leading to that. So that really led me to really engage in a lot of grassroots organizing work, especially with the rise of evidence and documentation of police violence, especially as it relates to LGBTQ populations, Black and Brown people. So that really got me into grassroots organizing, where we're learning how to hold our institutions, our hospitals, our clinics, our government accountable, but recognizing that in that action as well, that there are limitations, especially in the grassroots space of knowing how to mobilize, people in institutional offices like in public health, or how do you get people to be passionate about people's health, and also how do you engage your own community to be aware of things of impacting them as well. So that was a large thing that led me to kind of working with international organizations, working with local and international governments, specifically in South America, where I was a triage manager and coordinator there for a lot of their operations there to increase access to a lot of people in rural locations. That brought me to the United States, where I continued to do grassroots organizing work for police brutality, youth incarceration, and then that's kind of where I hit that limitation of, okay, like grassroots organizing is only doing so much, because once you get people on board and they're like, yeah, I agree with you, how do you keep that accountability up? How do you keep people kind of going with it? And that led me to realize that there's a deficit in my knowledge as well, as a grassroots organizer, not really knowing what goes on in these administrative spaces, in these institutions. So that led me to kind of go forward into consulting work, into public health, where you really get into that nitty-gritty of policy, of advocacy, and especially history, I think is a huge part of it, of understanding that, someone not being able to afford access to a hospital visit or even know what a vaccine isn't just this individual instance, but it's this long-standing history that's systematized, that can be tied to policy, to even just how we interact with one another. So that's kind of why I chose to join public health and join this space, as we've seen with the pandemic and how that exacerbated a lot of racial tensions and brought to light how public health has deep ties with the wellness of our communities, trying to really integrate the grassroots experience that I have as an organizer to the institutional knowledge that I'm now learning and that I have, to really bridge that gap to empower communities and let them know that we're here and that we need to rebuild that trust that a lot of them don't have, just not even with Boulder County, but across the world. So yeah, that's what I'm here to do, and happy to, answer any questions. What I'm seeing so far is that this organization is absolutely wonderful. There's a lot of people here with a lot of passions. I know Heather, was one of the leads for the Health Equity Coordinating Committee, so HEC, which I'm now coordinating and co-leading with. Noticing that there's so many different needs and passions. There's a few members here as well that have voiced their concerns and their goals and their vision. So it's really taking that and bringing everyone's vision into an operationalizing space. How do we record that? How do we make evidence? and not only to care for our communities, but to make institutional changes so that we don't have to keep relying on interventional strategies, but more preventative strategies, and internally and externally. Thank you.
Welcome.
Where did you come from before this?
So many different places, but I will say Los Angeles. Yeah,
Okay,
that's home.
that was the most recent one.
Most recent was New York.
Okay, wow, yeah,
All over.
world traveler.
Yeah.
Well, Kevin, we look forward to hearing from you, and I think, just in listening to what you were saying too about institutional change, I mean, please include the board in in your planning and your reflections about what can happen, because in our role of trying to set some agendas for the department in partnership with the executive director, it's just really helpful to know what you're identifying and how we can support that work.
Okay, item 5, director.
So I know that we continually try to provide you all with thoughts about what's going on inside the agency. And as we kind of lighten up the Board of Health agendas, as we've tried to do, hoping that that creates space for you all to be able to ask questions, have a little bit more time to ask questions about the director's report, or to highlight areas where you would like to have a deeper dive in the future. You'll notice we've added a HEC section to the report now that we have our HRE manager. So you'll receive monthly updates on what's happening in that space. We have tried to also use the director's report to give you follow-ups onto some of the kind of topical issues in the community, even if we don't have them on the agenda, so that you can stay up to date on kind of what's happened in specific spaces. And I'm here and happy to answer any questions that you have.
This is not on the director's report, but this was something that I wanted to ask. I think I had asked several months ago about a sort of a COVID post-mortem and a pandemic plan. I know that, Lexi, you had noted that a lot of that work's being done at the state. And I was wondering if we could, at some point in the future, get an update on sort of COVID post-mortem. What would a pandemic response look like in the future based on the learnings that we have from COVID?
Yes, so we've done a number of internal after action reviews. And that vision of how do we create a better plan for the future, I think is a really rich opportunity, and our emergency management team will be in that space this year. We really are looking at how do we rebuild our emergency management responsiveness? How do we get our staff back into an updated training space? How do we think strategically about how we would deploy the workforce more effectively if another pandemic or something with that kind of similarly long-term impact were going to impact us? I think one of the challenges that we had was that pandemic response, was basically, despite public health at large's continual reminders to policymakers that this could happen at any time, there wasn't money that was really dedicated to it. And to a large part, there still isn't. We have some of our important deficits right now are in supporting an effective emergency management team just to keep up, much less to do that preparation for the next pandemic. So I think your question is really good, and it's part of our thinking as an agency about how do we find the resources and effectively develop out the plan for the next pandemic that takes into account our AARs, our after action reviews. We're very aware that public health generally, and including Boulder County, was not perfect in this pandemic response. If we had a do-over, we'd have lots of things that we know we'd want to do differently. And getting ready for that is really important. I mean, we are also continuing to, track threats that could develop into the next pandemic. And I think that tension between kind of short-term emergency responses and really things that are longer term, whether it's a pandemic or whether it's something else that is a longer-term response, is really a critical piece of work, and it's on our radar, and we're working to figure out how we would address that. We have some specific plans in place. I can't tell you when we'll have them ready yet, but we will absolutely put it down on the list for Board of Health updates in the future.
Dear, did you have a comment?
I think Jordan had, or no, you can.
Yep. Can you hear me?
Yeah.
Yeah.
Okay. I think Lexi did a really good job of talking about how we're taking the after action reviews that we've done throughout the pandemic and really trying to learn from them and figure out how do we need to structure for the future, particularly with climate crisis coming. We know that this is, it was a pandemic, but we're going to be faced with future challenges. So that is one main aspect that we're looking at. And if emergency management does become an agency priority, we're looking at a 3-year timeline to fix things. It's going to be, these are pretty massive structural changes that we need to make. The second thing that we're doing in regard to the question Brooke asked is about, we are building an endemic plan. So just as much planning that we did going into the pandemic is going to go to kind of moving us out of the pandemic. And one of the things that I should share is that the tail of COVID is a little bit long, which means that, how before we had priority populations and we structured our case investigation and we centered a lot of our work in the priority populations. With the endemicity coming up in May and really calling it endemic, we're actually going to be shifting to what's called priority settings. So we're still going to have to do interviews and do outbreak investigations in specific settings like jails, congregate livings, shelters, and do some work in early childhood communities. So there is still work with that tail associated with COVID. We're also trying to keep track of what is happening at the federal level with vaccines and what will happen in the fall. Really starting to plan on what does a booster campaign look like in the fall. One of the challenges that know that we're going to be facing is a lot of people will be coming off the Medicaid. So if you haven't been following, what has happened is in 2000, people were eligible for Medicaid. They stayed on Medicaid and they had continuous enrollment for them for many years, but a lot of them may not be eligible for Medicaid, but they're still kind of in that system where they don't make enough money to afford, that private insurance. So there's going to be some gaps and some needs, and we do feel like our immunization team is kind of preparing and watching and monitoring what is happening at that level. And then in terms of the communicable disease control, we'll still have some basic needs there. So we are kind of trying to be very thoughtful about what that plan and the execution of this endemicity plan looks like. So that way we can kind of slowly communicate to the public. There are things that we probably have to go in and update all our websites, right? We're going to have to make serious changes with communications. So there's a lot of work to be done in this space, but I appreciate the question, but I don't think we have as many answers yet. But our goal is to be ready for that May timeline. I hope that helps.
That helps. Thank you.
Any other questions on the director's report?
Is it giving you what you need?
Yeah, it's good. Definitely.
It's very good.
I appreciate it.
One thing that would help, I still, is also if we could get presentations ahead of time.
Presentations ahead of time,
If I understand it's not always possible.
like Saturday night.
Not Saturday night. But like
yeah.
even just to sometimes skim the slides for those of us who
Yeah.
aren't always the greatest verbal process.
I hear you. We can look into that. The challenges that often.
Not a requirement.
Yeah,
but,
often we are working up to the last minute on the presentations, but I hear your request and I understand. If we can't do kind of full presentations ahead of time, maybe what we can focus on is building out kind of what we're going to talk about and some key pieces for you to anticipate in that front section.
Yeah, I think that's the only thing that's missing in the new version versus the old version, which just sort of sometimes you can just fill bullet points.
Got it. That's helpful. Thank you for letting us know. And I think that's very feasible.
Don't take a little longer.
I get it. We all are different learners, right?
And I'm on, I mean, that strategic planning, that's a really complex, there are several moving parts to that, so it's hard to. I mean, I'm in the space every day and it's like, it's swimming through mud sometimes.
How far did we, I mean, like, I know we created it in well, we had it ready for 2018, right? I mean, so we got 2019 and then everything kind of stopped. Like, how far did we get in any of those priorities in that first year plus?
So remember that COVID kind of took everybody in the
Yeah.
agency for the first 9 months to respond to. And our MVH coordination lead was was out of commission for a while
Okay.
due to health issues. So I'm going to turn it over to Kelly, who was actually here during that first year, which I wasn't, to talk a little bit more about that.
Yeah, that's a great question. And I wasn't actually here for the CHA or when they did that or anything. I guys came in after that, but as Lexi was saying, all our staff were pulled off into COVID, right? So all these spaces kind of took a back seat. On the other hand, I think what we're trying to look at is we do think there are my blank Spanish achievements made in this space that we weren't exactly necessarily measuring. This is why I'm so big on measuring, right, these spaces, because I think in particular with the pandemic, especially around health and racial equity, I think there's a lot of learning in that space. And then this past year in 2022, we've done some youth mental health work as well. That's going to be, as Elise was saying, is going to basically help us as we look forward. I think in climate change didn't get very far off the ground. And I think the sustainability, transparency, and stewardship also didn't get far off the ground. But I think another reason behind that was because that's when they brought in Oracle and they just blew up that whole system. And so I think that we're trying to do now is build that foundation so we are measuring, from the get-go and how we're implementing in those spaces where we didn't get to that space. We're just pushing really hard for that, but it was a hard, we had work groups and things like that, but I think we're a little bit different in the way we're approaching. But it's a great question, and we will build a report out for the community because we owe the community that, even if it's just, not as much as we wanted to do.
Yeah. Okay, great, thank you. Okay. All the new business, any announcements? No. Okay, item 7, we are going to adjourn into executive session pursuant to Colorado Revised Statute 24-6-4024F to discuss the Boulder County Public Health Interim Executive Director's performance review. And pursuant to those CRSs that I just mentioned, purpose of legal advice related to the permanent executive director hiring process. So thanks for tuning in, everybody. Lindy, we'll see you on the other side. Probably take a little 5-minute break here. And then we'll reconvene.
Thank you.
Okay. Thanks.